What's up, everybody? Happy Monday. It is March and it is moving. Time is just flying. I remember we were just talking about Merry Christmas and Happy New Year, and now we're talking about turn the clocks forward. You know what I mean? And we got presidential things going on, and we got a lot of stuff going on in this world today. So there's so much to talk about. I hope you all are having a wonderful day. I sure am. Everything is going great on my side of town. I hope it's going good on yours. Doc, how are you feeling? What's going on?
Well, I don't know about you guys, but we just got almost blown away yesterday. Our wind chill was like 30, 40. My light, look, my doorbell kept ringing and ringing, and the wind was ringing it. I go out front, and my dog, my dog is looking at me like, "Why you keep opening the door?" I'm like, "Well, maybe you ringing the doorbell, but
Yeah,
it's ringing." Uh,
yeah. I mean, the wind is crazy. I
yeah,
was just like, what's going on here? You know what I'm saying? So I was like,
you know what's going on? Global warming. You
yeah,
know, we have abused this planet so much in just the few years I've been on the earth. I see a lot. We trashing a lot. We're doing crazy stuff. So the earth is upset. Big fish are being whales and sharks. Well, whales are uh, washed up on the shore, dead. So the temperature is increasing. So anyway, happy spring forward.
yeah. Hey, let me ask you a question. What you saying that does anything like that affect our health?
Yeah. So many things, and I call it environmental toxins, but there's so many things that affect our health um, because of the weather changes. We have what they said we had the hottest, the it'll be either the hottest February or the coldest April or whatever, and
Mm-hmm.
the measurements are even going higher and higher. And
Mm,
as things are happening, such as what the water temperature is in the ocean, etc., it's affecting the fish. It's affecting the equilibrium. And when the equilibrium is affected, and we're eating those things, then it causes toxicity. Not to mention the air quality, um, and we have the forest fires, all of the fires, and the floods. So it's affecting our health.
that's very good to know. Oh, and let me just give you a big shout out. Happy Women's Month to all the ladies out there that are watching and will be watching later. It's your month. I mean, it's your month every day. So let's not cheat you like we tell people about Black
And
History
let,
Month.
and let me give a shout out. It's International Women's Month, International Women's Day, and it's Women's Month. And my daughter, who is international, she's in Ghana.
Yes.
So she's truly celebrating. Well, she celebrates Happy Women's Month every day, but she's truly celebrating this month.
Yeah. We one day we might have to get A on and see what she's doing over there in Ghana. And because is she still doing her health stuff over there too with the
She's doing quite a few things. She's more political now,
yes.
because she is the vice president of the African American uh, Ghanaian Society. So those are folks who expatriates who just got tired of being here, hundreds and
Hmm.
hundreds of them, and they went to Ghana, and it's a big group. She also is very active in her Delta Sigma Theta uh, chapter that's there, and she does health issues as well. She does a lot of, like I said, she's a politician there already.
Good,
So
good, good, good. I mean, you know what? I'm gonna reach out to her and next time you speak to her, I know you speak to her. Tell her we might have to get her on for this month so we can find out what's going on with her.
yeah,
You
because
know?
she does travel. So she's hosting Howard University alumni group twice this year, and does a lot of travel to help people come to Ghana the right way and to see Ghana like you never seen it before, and like you never
Mm.
will unless you're traveling with Adrian Corder.
Yeah, there you go. That's what's up. So, is there anything you want to talk about specifically today?
Um, you know, Several things comes to mind, and I just want us to understand that what one thing, and I know we just had heart health, which was February, but every day is you want to keep your heart healthy. And so many people will hear, you'll hear folks say, I have congestive heart failure or something's going on with my heart. So I want to focus on a few things that will affect your heart. Um, we always talk about obesity. That's of course one. But we also need to talk about something that many people don't even understand or know about, which is sleep apnea.
Mhm.
And we joke around when we say somebody's snoring. Somebody, look at them, they're snoring is a big joke. But each time someone snores and thereafter there's a pause in their sleep, they're aggravating their heart. So sleep apnea is real. And it's
Mm.
not just real because their partner can't go to sleep because their partner is hearing all this noise, but it's real in terms of what's going on and how it's affecting your cardiovascular. So those people who are snoring, please go see your doctor, your ENT. You may end up having something called a CPAP to help you breathe better because that apnea means just that, without oxygen.
Hmm. So I mean that on the light side of it, you're right. Like sometimes if your spouse is snoring, you're like, okay, I can't sleep either. But you know, the severity of it is, you know, sometimes if you snore, you're
Hmm.
sleeping on your back.
Hmm.
Is that as different if it's somebody snoring on their side or just snoring in general? Because I mean, is there? I mean, there's different levels of snoring. Like you could say, oh, okay, I'm snoring. I'm laying on my back. But then if I'm laying on my side or on my stomach, I don't snore. So.
Position makes a difference for sure. And
Mhm.
if you turn somebody on their side or you just kind of startle them, they'll stop. So that kind of helps some of the airway as they're repositioning. Sometimes, as well, sleeping on one or two extra pillows or putting a wedge under the mattress will also assist in that airway. But if you're thinking about you laying flat on your back and you're having obstructive airway, that's what that snoring is. It's a sign,
Mhm.
it's a sound that indicates that your airway is obstructed. Now, it's funny, as a pediatrician, I'm you know, don't see that a lot, but I do see it a lot. When I see it a lot, I see children with large tonsils. And when they have large tonsils, as they're breathing, they're snoring at night and their mouth breathing. So they're trying to
Mm.
compensate that for that lack of airway. I just had a patient just have his tonsils out, and the mother called me and said, he's not snoring. They ran in there to make sure he was still alive because he was no longer snoring.
Right.
So
Right.
something, and as we hear about people snoring, we often will say, "Oh, those are the heavier folks." Well, there is something called Pickwickian, which is a term we use in medicine when somebody's barrel chest and they're real big and heavy and they're going to sleep and they're snoring. But you don't have to be heavy to still have airway obstruction, to still have apnea.
Mm. So what are things if you do know? What do they do for people? Because I have coworkers that I've worked with that tell me that they have sleep apnea and stuff like that. So I mean, they give you tests or you have to go sleep someplace, right?
Well, there's a Hey, yes, you do. Not on the sofa in your house. You got to go to what we call a sleep study lab.
Yeah, yeah.
But before that, you know what I do? I call it the poor man's test. Have one of your loved ones just take a video of you sleeping when you're really sleeping in what we call a REM sleep. Not as soon as you fall asleep, but when you're deep sleep, and they can show the ENT, the specialist, how you're sleeping, and you'll see it's almost like a startle effect. You're sleeping, you're snoring rather, and then you have this episode of no respiration, and then some people will startle like because you feel like you're choking, but you don't even realize this is happening. And
Mm-hmm.
there's a lab we call a sleep study lab that you go and get your and you demonstrate it, and they have a machine that they put on your probes, and that they can then evaluate how many times you had sleep apnea during an hour, and you'd be surprised how often it is. But people live with it. But you know what it's doing? It's aggravating your heart. It's affecting your heart. So
Wow.
so if nothing else, the takeaway is snoring is not just funny. It can cause horrific effects on your heart.
Mm. So people out there listening, if you have any questions, because a lot of times everybody act like they don't snore until somebody pushing you in the middle of the night talking about, yo, come on, come on, come on, I can't sleep with that shit. You
Right.
know what I'm saying? You know what I'm saying? And I'm sure we've all been victim and we've all snored for to some. Because so let me ask you a question: is snoring common or is it uncommon?
Well, it's not uncommon. Let me just say that. And so many people do will snore and don't know, or have episodes. I'm not talking when you have a cold and you have sinus infection, etc. But snoring is um, common as you get older. Um, we again we relate it to excessive weight gain, because that heaviness is obstructing you having your in inhalation, exhalation. Some people will say that um, people with really thick neck will have narrow airway. Some folks who have different respiratory problems, COPD, where they have problems in their airway. So you just have to understand the symptoms. But the main thing is seeking medical attention. Don't put it lightly. Don't put it off lightly, because it's very serious. It's a very serious um, condition. And when people get diagnosed, and then they have to have what we call a it's a device that many people don't want to wear because it makes noise. But now they have it much nicer, much partner friendly, as well as patient friendly.
Mm. Our friend Stefania is on here. She has a question or a statement.
so so she's not, you know loud snoring can be, like I said, that can be a deal breaker. uh
You're right. You're right.
so first of all, the main thing is video somebody. Just, some people, they deny it and deny it, and I'm like, how do you know you're not snoring? Now some
Right.
people wake themselves up because they're so loud and they wake up. But you want that loved one to get seen, but you want to video it first. Don't just video them sleeping. I mean, in terms of their airway, don't video their whole body, but just video so they can understand and appreciate how they're gasping for air during their sleep, and they wake up with a dry mouth because their mouth is partly open because they can't breathe. So, or they have insomnia, or they have interrupted sleep, and they wake up kind of cranky because they're never in deep and good enough sleep. So sleep that's restful.
And they're not the only one that's gonna wake up cranky. Everybody gonna wake up
Right,
cranky. Because if I
right,
can,
exactly,
you
exactly.
know, I mean, because it's so funny because dogs snore.
Oh yeah, mild snores.
Oh my God. Oh, listen.
I have a, we have we have a dog that snores, and you be like, who is that? So
Yeah,
yeah,
you think it's a grown person.
right.
Towards the night before Christmas. You'd be like, what dog snoring? You'd be like, is something wrong with his snores or something? He need a longer
Right,
snores or something.
right, right, right.
But,
So
but
the elevation, so elevating your head, like a wedge up under the mattress, extra pillows, um, getting it evaluated. You just have to get it evaluated, because what it does, it causes hypertrophy. It will enlarge your heart. It will aggravate and do things that sometimes irreversible to your cardiovascular system. So that you don't want.
mm, and people don't understand it. It could be more serious than just, oh, I snore,
Right,
uh,
right.
and I'm tired. Because people always say I snore. I snore when I'm tired.
Or when people
No.
people they snore when they drunk. When
Yeah.
they're drunk, it's almost like I'm forgetting to open my mouth, or I'm forgetting to whatever. But
Uh-huh.
but you want to make sure, like I said, chronic snoring is serious, because again, it's apnea, apnea. When you have sleep apnea, no matter, it can be daytime when you falling asleep and you having episodes where you're not breathing, and then when I say you're not breathing, you'll hear the respiration, and then it would be a pause, and that's the apnea. That is serious, and it affects your heart.
Mm.
So that's one thing. So be aware of how you sleep. Now, the other thing we're talking about heart, be aware of what you're doing when you're awake. And when I say that, if we're talking about your heart, you want to make sure that, number one, you're eating better. You're eating heart friendly foods. You don't have to have high blood pressure to be affecting your heart in terms of in a bad way of your eating. You can have high cholesterol. And when you have foods that you're eating that adds to plaques, atherosclerosis is the formal name, but just adds to grease and plaques in your vessels, such as that greasy pork chop and that pizza, all the grease coming, the fast foods. Um, it doesn't just go away. It goes away as you swallow, but it's in your system. And if
Right.
you think about years ago, the grandparents, etc. Or even sometimes lately when you have grease after you fix bacon or whatever, you pour that little grease in a container for coming back later. Well, that grease that you pour it in a container is also in your body. And just like it's hardening in that container on the stove, it's also hardening in your arteries, your vessels. And those are called plaques. Again, a big word is atherosclerosis. And it's it creates blockage. And that's why you hear folks say things like, I went in for a bypass. I went in for some stents. I went in, coronary 3 or 4 triple bypass. We're not talking about scoops on ice cream cone. We're talking about serious procedure to open up the diameter of your vessels that feed your heart.
Mm. That's very important to know. I mean, like I said, I've had a friend that, I guess it must have been very problematic for his loved one at the time. I mean, and they divorced now. I don't know. But I don't know if that was one of the reasons. He probably had a culmination of stuff that made her want to leave him. But I know, when he started talking about, yeah, I got sleep apnea. And I think a lot of people ain't really not trying to claim anything, because people don't want to say, oh, yeah. I mean, and it's one thing you're at the doctor where everybody's there. I don't know what is that doctor called?
Well, first is your primary care, because he
Okay.
can look in your airway with a light, um, and look in your throat. But a lot of us outgrow our tonsils. Some of us have had to have our tonsils taken out, called a tonsillectomy, as I did, adenoids and tonsils. But some people, they don't have large tonsils, but they do have sleep apnea, so they have airway obstruction that you may not be able to see visually. So part of your history that the doctor should be taking is, how do you sleep? And some people say, "Oh,
Mm-hmm.
I sleep all night." Well, but how are you sleeping? I'm not asking you what time you go to bed, what time you wake up. We're talking about that in between sleep. Is it REM sleep? Is it restful sleep? Does your girlfriend or does your mama, are you snoring? So take a video. Just take a
Yeah.
video. And then you go to a sleep study lab, or you go to an ENT, and then it depends on the degree of snoring, the degree of airway obstruction, and they will give you sometimes a CPAP machine. Now, CPAP machine years ago was very cumbersome, very cumbersome. Got this big machine that looks like I don't even know, it looked like a robot or whatever, and it's tubes, and then you put this thing on your face. So that's not sexy. It
No,
really
no.
is. That's not sexy. So not only your partner done left the room because you're snoring, but your partner done left the room because you looking like Hannibal. When you're looking, you're, you're looking kind of
Got
rough.
all these tubes and
Right.
stuff around your face and
Right.
mouth,
Looking
looking
like
like
an ICU patient,
looking
So,
like a different kind of serial killer.
but
You know
now,
what I'm
right,
saying?
but now they have the little strips. You can get that opens up the airway some, so you could do something that's not as intrusive looking, invasive looking, but still helpful. Not to
Yeah.
mention old-fashioned stuff, nasal spray. We used to call it neosynephrine saline spray. You're going to be able to take a deep breath, and you want to make sure that you're breathing, and the air quality in your room is important. So,
Yeah. And, so it's important, like you said. So you go to the doctor, and you say, show him a video, and he was like, okay, wait a minute, you snoring a little different. And like that's at that level, because there's different octaves for that snore. You know what I'm saying? Like,
right.
oh, you'd be like, whoa. You know?
You know, like all kind of animal sounds, all all
Yeah.
kind of horror stories, horror
Like,
sounds.
like you got something inside you. Ty G, what's up, Ty? She got a question for you.
Yes,
Yeah.
and you know what is funny? My dental colleagues love this question. The connection between plaque on your teeth, and your arteries. So I'm gonna say this, especially with black people, we weren't paying attention to our teeth until recently. When I say recently, maybe in the last 3 or 4 decades. Even doctors, we tell folks see your dentist annually, but really going into depth about your mouth. But you can have the quality of your mouth, your gums, your decay will affect your everything, including your heart. And she's right. And the bacteria, they will tell you that diabetes and hypertension when your body has inflammation, and your body, you can't just take your mouth and say, okay, put it on the side. Your body includes your mouth, your oral cavity. So if it has inflammation, if your gums are bleeding, you have decay, you have gingivitis, you should get that treated. Some things I'm gonna tell you what's a good thing: oil pulling. I don't know if anyone on in the audience have heard of pulling, like with coconut oil. That really helps your teeth. That really helps your mouth. Some baking soda. Of course, brushing more frequently, however way, be it with and then flossing. So we often will just say, "We'll just pull the tooth," but you want to save as many of your natural teeth as possible, but you want to keep up with your hygiene of your mouth. So that's a very, Taji, that's truly a great comment to make. Take care of your mouth.
Yeah, especially if you're talking to somebody and they blinking all the time, or they every time you talk and they passing you some lozenges, some certs or something. You need to check out your mouth game. You know what I'm saying?
Right,
Don't
right.
like don't. It's one thing. I don't know if you know this, but somebody was telling me is like bad teeth hereditary too. Do you know anything about that? Man, we don't have
There's
to do
some
this.
conditions. There are some conditions, auto recessive conditions, that dental strength and bones, because your teeth are your bones, is part of your musculoskeletal. So bad teeth, to a point, are hereditary. And then, of course, what's hereditary is the habit of not taking care of your teeth. So if your daddy and your mama ain't doing your teeth right, you ain't gonna do it. So
Yeah,
that's more the hereditary that we see.
yeah. I was very proud that Grandma used to say, "I got all my teeth." And
Oh,
whatever they went, they went. But she had all her teeth. She said she used to tell
oh
me.
yeah, yeah.
I said, all right,
All
Grandma. I
right.
said, good. So that, at least I hope this is hereditary, and I still got all mine in my mouth.
That's right.
You know what I mean?
That's
There
right.
might be a little caps here, little cavities there, but I they still mine. Stefan, your girl got a question for you.
Oh, so that's an OBGYN question, but I can answer it a little bit.
Mhm.
So a good friend had an IUD, and she, so she thought. Long story short, it fell out unbeknownst to her, and now she's expecting. I can't say how common that is. It's one of those things that it can happen. I'm not going to say that it was placed in, with air. I don't know her body in particular, as well as how long that IUD been in there. But you've had people come out, babies come out holding the IUD. It's like, hey,
Wow, really?
if it's meant to happen, it's meant to happen. That's why I'll say this. I hope I don't scare people. We've had folks who've gotten pregnant with after their tubes have been tied. You know,
Wow.
so and a story, and as well as after vasectomy, a real vasectomy. And you got some of the players telling these girls, "Oh, I've been fixed," who haven't been fixed. But there's some folks who've been fixed and thinking that they are, protected from getting someone pregnant, but somebody they got pregnant and it's their child. Okay.
Wow. So yeah, that's you know what? I don't even know if you're right about that. That's something. If you think somebody have their tube ties and then they still get pregnant.
It can come loose. So it all depends. Some people say, well, not only tie it, snip it, and burn it. Okay.
Oh,
The
okay, I've heard that.
ends.
I've heard that. And
Hmm.
so there's different levels when a woman has her tubes tied. You can tell her.
Well, I mean, standard is to tie your tubes, but sometimes you want to make sure that those tubes never reconnect, and to make sure that they will never see the ends of each other again.
Right, right. You keep one tube over there, keep the other tube over there. I get it. So something to think about. I think most of our listeners tubes is just tubing. I think we had that good age where. Well, let me ask you a question. Besides Mary, is anybody in their 50s still getting pregnant? Is
Oh
it
yes. Hmm.
okay?
Well, they say Janet Jackson. I don't know. Had a baby at 50. But I have two patients. I'm still in my office. Two patients, um, mothers rather, who 50 and 51 had their first children. Now they went to I. They had some fertility issues, but they got pregnant.
Wow.
Hmm. So, and speaking of that, and I know we're in the political season. It's
Especially
really,
well, that's a big topic. Yep, yep.
women's health is a very big topic, and I feel like this. We don't tell men, you know, how to tie their tubes or
Mhm.
vasectomies, and or we can't tell them don't get this girl pregnant, don't get this girl pregnant, or also wear a condom. So why is it that women's health is on the table and men are doing the making the laws? And
Right,
if
right.
it's the unwanted pregnant, I keep saying, I wish that men could get pregnant. I really do. I really do. I mean, I know, no offense, but I just wish that they could get pregnant. Okay.
They know what it's like. Yeah,
Right.
exactly.
Right.
You know?
So,
Yeah.
and then all of this information of you know, going putting doctors in jail for terminating the pregnancy, and if she doesn't want that baby in her belly, then my lord, and I don't. Let's just say it's a personal choice, and every baby is a miracle once it's born. But if you pregnant,
Mhm.
however way, and you don't want that pregnancy, then that is your choice between you and your doctor and your Lord. Not for
Yeah.
somebody to say you can't have a baby. Not to mention the rape victims and the children who have um, disability, not just genetic conditions, and the mother's health and danger, and they're still saying, well, and then these in vitro eggs that they now saying is a life. I'm like, wow, it's a lot in different state versus another state. So I think Biden is going to win just on that. Now, I know we
I-
talking about the border and people crossing the border, but
yeah.
I
Yeah.
feel that it's a lot going on the political scenes, and we need to get out and vote. So if nothing else, every time I'm on every show, I'm going to tell folks get out and vote. Don't sit back
Exactly.
and say I don't like none of them.
No, no, no. It's like you always got to tell somebody it's like the worst of two evils. You know what I'm saying?
Right.
But like, which
He
evil
may
you
be, and
want?
he may be old. I had an aunt that was 106 years, 7 years old when she passed. But I tell you what, her brain was sharper than people a third her age, and she knew
Yeah,
everything. So don't cut the man because he's old,
yeah,
because you
yeah.
can be 40 years
I
old
mean,
and dangerous. I'd rather Biden than Putin,
yeah,
no
yeah,
matter what.
yeah, yeah. Yeah,
Okay.
just because a man tongue get a little tied sometimes don't
Right.
mean you know
He's busy. He's got a lot up there. Okay.
he
But
think
it's okay.
he
It's
thinking
okay.
fast. He thinking faster than he can speak it. So I
That's
get
right. That's right. At least he ain't stuttering. Okay,
yeah,
a lot of
yeah,
times they stutter because their head, their mouth can't keep up with their brain. So we can
yeah,
understand
yeah.
him.
He
But at
ain't
least
that.
he makes sense. He
Yeah, he
does
ain't
make
Daffy
sense.
Duck up there and all that.
And at least he knows the United States. He
Yeah,
knows
yeah,
Puerto
yeah,
Rico.
yeah,
Puerto
yeah,
Rico is the United States. I mean, some of the things that come out of Trump, it's like, oh my God.
yeah,
Anyway,
yeah, yeah. He calling people all kind of. I mean, it's just. I was talking to a friend of mine. We was having a post, and it's just like I like. I tell anybody, I don't care if you're Republican or not, but I look at you different if you're a Trumper. You know what I'm saying? Because it's just I just don't get it. Um, it's just the man talks a good game. Let me tell you something. He got a poker face. Excuse me, better than anybody I've ever seen because he'll make you believe that in the summertime it's snowing. So I get it. I get it. And one day we're gonna have the doc really rap on that because a lot of you don't know she got feelings on this. So as you can see, she just gave you a little snippet of it. But I would love for her to chop it up anytime she wants to on that. Vivian, what's up, Viv? She had a question for you.
yes, he has an interesting question. I'm very familiar with Crohn's. Um, that's like I call it the ultimate of IBS, inflammatory bowel. Um, it's Crohn's is inflammation of your gut to the nth degree. And I will say this: there are medications that she put there, mes- mesalamine, methotrexate. There's a lot that we recommend, but I feel like this, and I'm gonna make sure that if she can take my number down, there are some studies and there's some tests that will have you understand what's going on with your body from Crohn's. And I feel that some people benefit from knowing how their digestive tract is adjusting to the foods they're eating. There's something called an MRT. It's called mediator release test. Mediator release MRT is a test, it's a blood draw that you just get one time in your life. It's rather expensive. It's up to $2,000 to $3,000, and it tests you against 200 foods, and it will specifically tell you what foods you should not eat. It is your fingerprint. It is not a blueprint. It is not blood type like O or A. This is something that is specific to you. It's called food sensitivity. And I'm recommending for anyone who has not only inflammatory bowel, but also Crohn's disease to get that test, because then you have a list of foods you can or cannot eat. And the foods that you can and cannot eat are foods that sometimes are foods that are good. People say, oh, they're good for you foods, and they are good for you in general, that we hear about blueberries and Brussels sprouts, but there are going to be some things on that list of the 200 things that you can't eat anymore. I have my blood drawn, and I'm telling you, they give you a list. Let me see if I have my book. Here we go. This particular test, and I don't have Crohn's. I just wanted to make sure that inflammation of my gut got corrected. But this is, yeah, here we go. This is the MRT. And let me
Mhm.
just show you this without, yeah, this is mine. So they'll give you pages and pages of foods, this test. So I'm going to make sure she has my number
I'll give it to her offline.
of foods, yeah, that
Mhm.
you can, anything in the green, but the short greens, can and cannot eat. And they list from meats to grains to fruits, even down to ingredients. Like I can't eat paprika. Now, who knew that? I love myself sweet potato pie. I can't do it. I can't eat something that I was eating 3 times a week.
Right, right,
Brussels
right,
sprouts.
right,
Brussels sprouts. I love it, but I can't
right.
eat it. So, and I can't eat walnuts. I can
Really?
eat almonds.
Okay.
So, and when it comes up in the red, that means you never should have it. There's some foods. So, but this test is specific to you. It'll be different than your twin. So it costs some money, but it's worth investing. So I can get people to get it for the discount of $700. Just start saying, but this is a test wherever you are in the United States. I can send you the kit. You go to a lab, they draw your blood, they send it immediately to the MRT. Matter of fact, Costco was just talking about this test. So it's not on your insurance plan. You ain't going they not gonna pay for that. Okay.
Mm,
But
mm.
it's an investment that's life saving as well as it's worth it. A lot of people do it because there's something called leaky gut, where their gut is just inflamed, and they'll do. If you go down the aisle, the next time you're at CVS or any drugstore, and you see hundreds of pills for reflux, for antacid, for gas, if you begin to follow your particular MRT, you never will have that again. So I say all of that to say I'm not claiming that it's the total cure for Crohn's, but I tell you what, if you have any aggravation of your gut, your digestive system, you should know the do's and the don'ts.
Now, Doc, I've kind of got a gist of what Crohn's disease is, but for anybody out there besides myself that really doesn't know what Crohn's disease is, can you just give us a brief definition of what Crohn's disease is, please?
Okay, so I'm not going to get too medical, but I'm going to say Crohn's is like volcanoes happening in your digestive tract. It's
Mhm.
inflammation. It's almost like it's more than indigestion, to the point where you can have bleeding, you can have interference with the way you eliminate.
Okay.
It is a chronic condition. I usually when I have a patient with Crohn's, I'm thinking it's something like IBS, inflammatory bowel, or food intolerance, and then we do certain tests that the GI does with me, and then we come to the diagnosis of Crohn's. Now, Crohn's is different from ulcerative colitis. There is something called ulcerative colitis, which is mainly the colon with ulcers, and you have bleeding stools, etc. I don't know what's worse. I have folks with UC, we call it UC, and I have several patients with Crohn's. Crohn's, you'll have folks who, how it presents, they can't gain weight. Because it's like they're not holding the food, because it's like if you
Mm.
think of going through a tunnel that's on fire, the food that they're eating, the tunnel's on fire, and you're trying to digest, but you just can't. So the medicines that we tend to write are medicines that you give folks for cancer. Okay, like methotrexate, and but that's it. It's like we simmer it down, but we're not getting to the root cause, and that's why I want Vivian to know my number, offline, because I can begin to tell her you don't have to have Crohn's to benefit from this blood draw. But definitely, if you have Crohn's, you need this blood draw.
Wow, wow. Well, thank you. I appreciate you first in enlightening me. And Vivian just put in some messages. I'm gonna go back, everybody. I just want the doctor to see Vivian's messages. Vivian said uh, she's had it since
Wow.
1999, and she
Thank
said this one too. She said, "Tell her thank you so much, and I'll be looking forward to talking to her off so privately." Absolutely. So Vivian, just text me after the show, and I'll give you the doc's number. Let me go back to what
And
some other
one
people.
thing about Crohn's, they'll tell you not to eat foods that burn your stomach. I mean, like hot sauce. They got these tackies. They got these kids now eating foods that just can kill you in terms of these challenges. But nothing with hot sauce. Nothing that's going to aggravate in general. And definitely with my patients with Crohn's, I tell them please avoid and stay away from those foods that are irritating to your gut as well.
Mm. Stefania said she used to do coconut oil. I think cook with all coconut oil. I think that I don't know if that was something
Yes,
on.
that's the pull. Yes, the oil pull. That's very good. That's what I was telling about oil pull. If you could coconut oil, and you know how it's hot and it melts in your mouth, and you do oil pulling, and it really makes a big difference. One of my girlfriends started me doing that, and I'm like, that's the bomb. Now, sometimes I can't tell people; they look at you like, what are you talking about oil pulling? But thank you, because it is truly a good thing to do.
Mm. Now I'm just gonna put a little light on this. My man Mark, so he said, "Trust no one, cover up." Talking about having sex. I don't care. What's Mark? 8 to 80, you don't care. You ain't had nobody coming telling you they pregnant.
I
You ain't
know.
trying to take care of no kid in the 50s, huh? Stefania said, "Yes, women in the islands get pregnant in their 40s and 50s
That's right.
naturally."
That's right.
Really?
That's correct. That's correct. And I get lots of families because I have a lot of um, West Indian families here, and I get lots of families that are talking about, um, you know, the oops baby or the ninth baby, etc.
Mm-hmm.
Hold
Mm-hmm.
on, let me just put this on.
Yeah, go ahead. Uh-huh.
Okay.
Well, I'm listen. I ain't cheating on Malika anyway, but I'm glad I married. I'm gonna save my behind right over here in the United
Right,
States.
right,
I'm not going in no islands, and
right.
ain't gonna have no little Trevor running around here talking about it. Daddy, pop, pop. You know what I'm saying? We ain't doing. Vanessa said, what did Vanessa say? She said, "Good evening, good people. Glad to tune in the session tonight. Thank you. Shout out to everybody watching Real Talk Chronicles. Also, if you miss a segment or if you missed this segment, you can go to YouTube and watch it before it fades to black on Facebook. But you know, it's always here, YouTube. So for those that don't understand, we are on YouTube based. We're YouTube, Real Talk Chronicles on YouTube. The Selma show said, okay, she was definitely saying, yeah, when we was talking about pro-choice, she said personal choice indeed. Thank you. Absolutely. Let me go to some more comments. Mark has a question.
Hmm. Interesting question.
Yeah, he's an interesting dude. That's my boy. That's my dog. I love you, bro.
So, I'll say this for magnesium vitamin, take at night. Um, I prefer liquid because it's absorbed faster. It
Mhm.
depends on how your gut is in general in terms of tablets. A lot of people take a whole handful. I tell people, can you space them out, even if it's 10 to 15 minutes, as opposed to
Mhm.
a whole handful of vitamins at one time, be it night or day? So I would say there's a few that you want to take more in the morning, and then certain ones at night. I think your immune boost, your vitamins such as sea moss, vitamin C, uh, I'm blocking. Vitamin D, you could take anytime. Magnesium, you want to take at night. But some people say it doesn't really matter. Of the ones that get absorbed faster, your liquids, but most people don't like the taste of the liquid vitamins, but they are absorbed faster. Think about it versus
Mhm.
making your body work for tablets. And they now have, you know, the it's either tablets, liquid, or even you can stir some things or it's powder and you can just stir it up. Um, and and absorb it that way and drink it that way.
Okay, hold on. Vanessa has a question. Thank you, Mark. Good question. Or everybody's asking good questions tonight, so I'm not just. I know this is Women's Month, but I'll just give Mark a little boost.
We love you, Mark. It's okay. It's
Exactly.
okay. Um, Probiotics. Interesting. We didn't know about that years ago, but we realized that our gut needs good bacteria, and often different foods as well as antibiotics have stripped our gut. So your probiotics gives you that digestive kick, and it helps. And it helps. I think it really helps any type of IBS, inflammatory bowel syndrome, and disease. And so it helps anytime you have a settled gut, you have an improved immune system. If you think about that, because your absorption of all what you're trying to eat, the good foods, are absorbed better when your gut is settled. So probiotics are even advertised in formulas, baby formulas. We got it little from baby on vitamin D and probiotics. So the benefits of probiotics um, is beginning to be recognized and respected. So they are effective. Some people say, well, what brand? I'll tell you what, if you just got get some good old probiotics from Wegmans or wherever, you good, as opposed to no probiotics.
Got you.
May I also say this since we're on gut health?
Sure, please.
Um, um, Folks, we can't drink milk. So let's just stop. Whole milk, if it causes gas, just don't drink it. Don't drink it. Um, your body is telling you. So here's people, I take the lactate and I take the lactate tablet. Well, you already know you're intolerant. And you shouldn't aggravate your gut, because what you're doing, if you think of little, I call them volcano eruptions going on, that's aggravating your whole system. So stop it, stop it, stop it. One other thing, if you take two glasses, pour water in one, pour milk in the other, empty the glass out, you see a film in the one that had milk in it. Well, that's your gut also, and it blocks absorption of many of the nutrients that you're trying to take and trying to benefit from. So if I put a little bit of basic information, please slow down. After 2 years old, mammals don't need milk. Mammals need vitamin D and calcium, but we don't have to have it in milk.
So anybody thinking they was gonna have a little warm milk tonight or a cup of milk tonight?
With their oatmeal cookies.
It's oat cookies. That shit is over tonight. Doctor done put a damper on that one. And let me tell you something. It's so funny what you used to be able to do when you was a kid. Because I used to love cookies and milk at night.
Right.
You know.
I know. Yeah. Take it back.
Then you get older and you be like, yo, have a little milk. You may have that craving, a little chocolate milk. And next you know, you got you playing a little Earth, Wind, and Fire out your rectum, your behind and stuff like that, and then you're looking for a bathroom.
Yeah, but I have to admit, that little cereal, Raisin Bran, or shredded with a little milk, it keeps you moving. I remember having the weekend with Harry Belafonte. We were down when we were doing the anniversary of the killings of the little babies, and it was, I guess, it was 8 years ago. And the Southern Christian Leadership, I'm part of that on the board, and we had to go and find a box of Kellogg's, not even Kellogg's cornflakes. The hotel didn't have it. He was eating Kellogg's cornflakes every morning, Harry Belafonte, and a little bit of milk. I was like, we had everything else. We had oatmeal, we had the omelet. He said, no, I want my cereal. I'm like, you got it.
Yeah. You old school. Listen.
Right.
Cornflakes. You live that long. Who I'm gonna tell you
That's
not
right.
to what you got to do,
I looked at the hotel in Marriott. I said, y'all don't have this. We got to go down the street and get some cornflakes. It's okay.
Yeah. Rest in peace to Harry Belafonte, man. Yeah. Exactly. Definitely a true icon. Tajita has a comment. Let's see. That's my girl, Tajita.
They have a cure now. Sickle cell, we need to continue to talk about it. 12% of African Americans here in the States, 12 to 14%, have the trait. And many people don't know they have the trait. I love talking about this because it's very personal to me. My husband has the trait. I don't. We have 2 children. One has the trait, one doesn't. And I tell, the one that has a trait, I tell that child, when you thinking about having children, have this, make sure you know the status of that person, because 25%, one 25% of each pregnancy can have a SS, sickle cell disease. The 50% can have a child with a trait, and then the other 25%, if you think of genetics, 25% would be no trait. So you have two people with traits. They're healthy, they're fine, they're living their life like it's golden. They have a baby. It's like a roll of a die per pregnancy. That baby has a 25% of having both traits, which makes sickle cell, or 50% of having one trait and one normal hemoglobin. It's called the hemoglobin we're talking about. And then the other would be both of the good hemoglobins were given to that pregnancy. So sickle cell, but we do have cures now, beyond just the bone marrow transplant. I have a patient that had the first bone marrow transplant cured sickle cell 20 years ago, and that was here in DC. Mom
Mm.
had a second child who didn't have sickle cell, and my patient's brother, we did the bone marrow transplant, and the one who had sickle cell no longer had sickle cell, but the brother's bone marrow that he received to cure his sickle cell gave him asthma because the second child had asthma, but it's okay. He has,
Mhm.
he doesn't have sickle cell anymore. But now they have
Right.
medication. Insurances are talking about paying for it because it's rather expensive, but they just rolled it out. So your brother needs to make sure he is part of a sickle cell center so that they can get his crisis, and that's sad, he's always in crisis, under control. Hydration, urea acid. There's a few things that we still do. I was raised, when I say raised, I studied at Howard University, and Dr. Roland B. Scott is the godfather of sickle cell research. And as a geneticist, after I did P's, I did genetics, and I had hundreds and hundreds of sickle cell patients that we followed. So that's something that we have to still recognize and understand, especially as Black people. Now, the cells sickled as part of a survival from malaria. So that's why we're talking about people from Africa. In order to survive, the cells got sickled. So that's was part of our survival as we were 6, 7 generations in Africa. Unfortunately, well, we don't need it for malaria here, but unfortunately, the lifespan of a patient with sickle cell years ago, we didn't see them past 20. Now we see them 50, 60 years old. We just make sure that
Mm.
they are healthy and get hydrated, and it's a whole protocol that we follow. But that's a good question, and we all need to know. If somebody said they have a child with sickle cell, we all need to understand and know what that means, and we all need to
Mm.
know our status. You're not going to change if you have sickle cell trait; it's not going to go away. So, and you're fine, but you just need to know your status. So much for that.
Mm. Wow. Well, I'll definitely send my prayers first to all of you, but especially to your brother. I mean, because I lost an ex-girlfriend to sickle cell, so I understand what her family went through in regards to that. Um, so Vivian said, "Tell thank you so much. Looking forward to." Okay. She also said, "This is the one I wanted to put." She says, "They told me to stay away from spicy foods that might make you flare up." Okay.
Let me talk on that, please. Why do we have to have everything so hot? So hot? You know,
Listen, listen. If I don't have a hot sauce on it, then I don't want it. That's why I don't eat at people's house. I really, I won't eat at your house if I can't have some hot sauce because you ain't gonna tell me I'm destroying your food. Well, maybe I just made it better because it's going down my little crazy throat.
you know
So I
what?
just
You know what? I need to have you for just with you just need to understand how food tastes. Your whole food tastes different. Burned up your taste buds, all that hot mess. You got me almost cussing. Okay, you don't need that. And you know what bothers me? The kids come in here. I have a corner store across the street from the office. They come in with the Takis and the this and the that. And one
yeah.
time they say, "Here, Dr. Go to have one." Oh, I had to drink 2 bottles of water. I'm like, how the heck you do this? How did you do this? You done numbed out everything. So just imagine, it's not just in your throat, it's going down your esophagus. It's like drinking hard liquor. It's like, and these
Listen,
babies are doing it. And it's not a good thing. I think down the road we're gonna see more inflammatory bowel. We're gonna see more colon cancer because we're lighting it on fire. So yes,
mm.
Vivian, stay
Well,
away from spicy
you know what's so funny? I yes, this we're gonna have a family moment with this because And listen, I'm gonna put some hot sauce on some eggs. I'm gonna put some hot sauce on
Just
some.
do ketchup. You don't need hot sauce.
No, no, no. I want no ketchup. I don't want it cold. I don't want no.
You can
No,
warm up the ketchup. That's like tomato paste.
no. No. Everybody, listen. Doctor's always right, but this one I'm still having some hot sauce. She's just gonna have to look at me side eye
I'm
at
a
at the
Malika. Okay,
table.
we're gonna have to. And when you taste it, you can spice it with lemon, pepper, different foods, different spices, but not hot sauce. Okay.
I think the last time we ate when we was in Philly, I think I might have asked the doctor for some. I mean, the
I
other
look.
doctor.
I know the way. I know. I look at you. Yep.
I think I might have said, I don't know if you was looking, but I don't know if it was mashed potato or something. I was like, can I get some hot sauce or something?
Uh-huh.
Whatever it was. But listen,
I'll have to
but
cook
so a lot of things are really not good for us. I mean, like I am my father's child when it comes to that. My father, he would put, I seen my father, our family, he was sopping syrup. I was like, what are you doing? You know what I'm saying? For those that don't know, that's old school. You have bread, sit there like you just want a snack. You sopping syrup.
Right. Or mayonnaise sandwich.
Yeah, oh yeah, I'm from that era. Listen, I'm hungry. Well, here, take this mayonnaise sandwich and go back out and play. Dinner ain't ready. I mean, a lot of you out there, yeah, we're the same age, so I know y'all done had mayonnaise sandwiches, and stuff like that. So don't act like y'all probably making them now, old school. Your spouses and loved ones looking at you crazy. Like, what's that? It's mayonnaise sandwich. I'm hungry.
Yeah. So we gotta watch. We are. Listen, the other thing is, I tell folks, you can have see, now pay attention to this. Either medicine is your food or food is your medicine.
Ow.
Medicine can be your food, and that's where we are right now in this society. Or food is your medicine.
Okay. Doctor,
this is me. My food is my medicine. Okay. I've lost 10 pounds. I was pre-diabetic. I'm no longer pre-diabetic. All of the above.
Oh, you took care of that, huh? I know you because listen, for those that don't know, like I said, this is my cousin and my first cousin, not my 19th. So not too long ago, we was just having a little text thing, and she was like, "What's up with your numbers? What's your A1Cs and this and that?" Right. I was like, "Oh my god!" Like, she was giving it to me.
I was getting personal. That's
yeah,
right.
She was all, and as she's supposed to, but she was all on that text that day. She was like, "What's going on?" And I was like, "Okay." And that text, that's not a month ago. That was recently. So that's right. That is recently. Right. So, Brother Eddie's in the building. He has a question for you.
Please don't have surgery. Please don't. Okay. So, water aerobics, it depends on the degree of your hip. I'm not sure in terms of the arthritis, but I do know many people have physical therapy, different types of water aerobics. I'm going to go back to my topical CBD. I don't like a lot of medications by mouth, believe it or not, for pain. I'd rather it be topical, a spray, an ointment. Maybe my cousin can give you my information or me get your information.
Yeah, that's family. I'll definitely Eddie's my childhood friend. Yeah.
Okay. So, okay. I'll probably send him a PDQ and then see how that works and then show him how to get it. Okay. Yeah. But I don't I know the orthopedics guys don't like me, but I'd rather you not have a hip replacement or a knee replacement unless it's so severe. So let's try to limber up and oil up those joints by physical therapy and different things that can help. And even there's something called PRP. PRP is plasma enriched protein. The doctors who know what I'm talking about, they draw your blood, they spin it down, and they reintroduce your plasma into that joint. That's better than a steroid in that joint. And
was that what Kobe Bryant was having to his knee at the time? I think, yes. Someplace.
And that's what a lot of people. That's what Adrian does. She does PRP for facials, etc. But she now does PRP in joints. And it's like your own fluid that's helping build up that joint. So that's a whole nother conversation. But I'd rather you do something like that and something topical than go under the knife.
So what is there any? I mean, because I know I suffer from a lot of back stuff.
Yes, you do.
And arthritis and stuff. Yeah. So is there anything short term he could do before he gets to the doctor? Like, is it like planks? Somebody always tell me, they was like, "Yo, do planks and stuff like that, stretch your back out." I try to do.
I think you should go swimming. Indoor. I mean, swimming really helps. Okay. And if you pull up and Google hip pain exercises, nothing that's exertional. sometimes walking. It all depends on where that pain is. You don't want to overwhelm it, but you want to exercise it and get to the point where whatever was hurting, even to the point of a massage, a chiropractor, but all of the above before you say yes to the surgery. I don't. He said, "I'm not ready." You don't. You're not gonna have to have surgery.
Right. Okay. Yeah, because I mean, surgery. A lot of people. I've had a lot of, especially from in the martial arts. I know a lot of martial artists that have had hip surgeries and joints like that, and a mess. I mean, old school Bushido. We kicking 100, 200 times on one leg, and that's just one side of one combination of a kick, and then we're doing it now. Next thing you know, these guys are in their 50s and late 40s and talking about I can't walk, and they had to end up having hip surgeries and joint replacements and stuff like that. Mark has another question. What did he say? Thanks, Ed. So I'll give you Doc's number too. Text me after the show.
Yeah, that's interesting. The shakes. I was going to talk about sugar, and we do too much sugar, and it was just a report this week. They're saying more than 2 sugary drinks a week can aggravate your heart. I'm going to say it again. Now we know, I mean, some people would drink, we talk about 2 or 3 drinks in a day in terms of sodas, but sugary drinks, two up, 2 and above per week is pulling on your heart, no matter how much exercise, no matter what you're doing. So let's talk. I know Lent has already started and your New Year's resolution. As of today, let's just put the sugar down. Do your honey, learn to drink your teas and your coffee without sugar, and just get some water. Put a little lemon in your water.
Now I have done that, and Malika will put a little honey in there and stuff like that because you don't know how many times she done got her feelings hurt talking about, oh, Marilyn said, I told you I don't want to hear.
So and look, I know, but also let me also say this, because y'all got to stop using fake. I know you don't. Stop using fake sugar.
Yeah.
Fake sugar, aspartame, all that causes cancer.
Ooh.
Fake, you don't need it. You don't need it. So, and you don't need the sugar. So cut back on the sugar, gradually cut back, and don't replace it with that fake stuff, with the pink and the blue equal. The little packages. Stop it.
So say it for the people in here that probably right now, or maybe having a little evening coffee or tea, right, whatever.
Learn to drink it without. Put a little cinnamon. Put some cinnamon in it. That makes it. There you go. Even coconut milk. Yes. There you go. Coconut milk and rice milk are better than cow milk. Yes, Mark. Almond milk, yes. Oat milk, yes. But not cow milk.
Vanessa said, forget the milk.
I like the yogurt, yes, and the kefir. Yeah, yes. I'm saying yes. They are scholars here.
Yeah, look at these. Who knew? Mark said I was.
Yogurt is good.
Let's see.
Yeah, that's right. Right.
Yeah, warm December. Exactly. I know. Rest in peace to your sister, dog. Yeah. Exactly. And for anybody that doesn't know, Mark is talking about that movie with Sidney Poitier. He played a doctor, and he lost his girlfriend that he met in the movie, and it's called The Warm December. It's an excellent movie, phenomenal. I don't know why it doesn't get the buzz, but it was about sickle cell, so we see why it doesn't have it. Look that movie up, Warm December. It's a tearjerker. It definitely is. Have you heard about it?
I have. So I'm not an expert on that part of that injury. That condition, but I have a patient. I have heard of chocolate ankle. So we'll come back and talk about that more. But tell me, is it somebody that you know that has that?
Diane. So Diane, that's a question for you.
Sure, eggs are fried. That's funny.
That's
right now. They say they fried and boiled.
Mark, this weekend I will be. You know where I'll be up there. I'll be getting that spicy chicken. I'm not listening to this doctor right now.
And then when you have indigestion, just think about me, okay?
Yeah. And then but see, you know what? I know this family. See, that there's a trait called nan. I told you so. You know what I'm saying?
That's right.
Yeah, this family right here be like, I told you. How about that?
Oh
You know,
well, I don't feel sorry for you. Remember, I don't feel sorry for you.
hey, let me
Look,
tell
we
you
say,
something.
a
You must
hard butt. Look, a
what?
hard head makes a soft behind. Y'all know it. You know it. You know it. Okay.
Yeah, let me tell you something,
Y'all
boy.
in the bathroom sick.
Oh man, this family tree over here, boy. You better have some thick skin. You come around us, you get your
Absolutely.
feelings hurt. You know. Vivian said,
That's spicy chicken, bro. No more. Yes, right. Tell them. And yeah, I think one time I accidentally had a piece of when they say spicy, and I was like, how can you eat this?
mm.
Yeah, it's
Mark, she won't be going to the spot with us after Row House. She won't get no spicy chicken. We have to give her the little, the mild chicken.
yeah.
Vanessa said, "What?" Mm-hmm.
Sickle cell is sad. I had a patient who had sickle cell and lupus. I still have
Ooh.
her obituary. She lasted till 40. She was like the poster child for sickle cell and lupus.
Oh wow.
Um,
Well, my condolences, Vanessa. I didn't know that. That's
yeah.
my girl, Vanessa. That's my dog right there. She's good
Wow.
people. Yeah.
Wow. So sad.
So
I'm so sorry to hear that.
okay, everybody. Let me read you a few more questions. It is past that time. The doc and I have been chopping it up. Hold on. Sharon has a question. We're gonna get her out of here, doctor, real quick.
Whoa. It can be weeks with shingles. We're about tired of getting shots, but I'm going to say this. If you're a certain age and you had chicken pox, that means it's staying in our system, and the shingles vaccination will prevent you from getting shingles. So,
And she asked this question too.
ooh, it's her third week. Have you tried any of those anti-itch type of sprays? Because it almost you don't want anybody you don't want to be touched in that area. But wow, um get her information so I can reach her too,
I,
Sharon.
I got
Vivian,
it.
Sharon. Okay.
Sharon. All right. There's 3 people that got to text me tonight. You see, you got the doc on the move right here. She said calamine lotion. That's the old school, right? Yeah,
That's
it's
old.
not working.
Right.
Uh-oh. Okay, Diane has a question.
Get some Benadryl topical.
All right. You see, Diane said about this.
Like I said, I got to come back on that one. That one I don't know.
Okay, Vivian says this one. Also, I was told it could lead to cancer.
I need to cancel. So that is why. Yeah, that's true. And because it's inflammation, anything that's inflammatory can lead to cancer. And that's why we have to watch what we're eating. We have to know what foods are not good for us, and then stop eating it.
Okay, I got another one. Sharon, you're going to talk to the doctor offline, so I'm not going to read that message. What's up, Miss Berry? How are you?
Oh yeah, the same from yeah. Yes. So what I'll do is do the next time I do a show, I'm going to do it all on MRT.
Okay.
And go through different things with the gut.
All right now. Vanessa says, what did Vanessa say? She said, acupressure, good therapy for pain or alternative to surgery.
Yes. Yes. I had a car accident. I was in a car accident and I had acupuncture. Now it was a little different. The man had these needles everywhere. And I'm looking and they're so small you hardly feel it, but it helps. It does help. Yes.
What's up, brother Jay Burnett? I thought you coming to see me. He said he has a question. He said, how was cane sugar? Everybody, this is Real Talk Chronicles. I know the doc is reading
Well,
messages.
cane sugar is more natural. I don't want a whole lot of sugar, but they'll tell you in one of this MRT, one of my patients ended up, they can't do fake sugar. They can't do a few things, but they can do cane sugar. So it's more natural than anything. So
And he
I
said,
just don't, but agave, yes. Yes. That's what my son takes, agave.
does he? Shout out to my man Fred.
He's my naturopathic child.
This is I'm gonna let this be the last one. Maybe you can read this. I'll let you read that for yourself. Hold on. Where is it?
Mm.
Oh no, not that one. Okay. My bad.
Thank you.
Thank
Thank
you,
you.
thank you, thank you, everybody. The Dr. Corder is in the building. Listen, I got a surprise for y'all. I have some close friends because I would want the doctor here all the time, but what I have is her. I have some people from HU, some other doctors that are close to Malika and I that have decided to join the show.
Uh-oh.
So I don't know if you remember, Doc. I was telling you about. Did you know the Scots? But they're a little
Younger.
younger. Yeah, younger, exactly. So they came by Row House. For those that don't know, I mean, part owner, co-owner in Row House. They came by Sunday, hung out, and I asked her because you all know I've been working hard with Row House, and I've kind of scaled back, and I only want to put out the best content I can for Real Talk. I'm not trying to put out a lot of gibberish. So I asked her. I said, Teresa, would you and your husband, or just you, would feel being a part of Real Talk Chronicles? I said, did you even know about it? She said, absolutely, we watch it. So I said, oh, I said, would you think
Good.
about being a part of it? She said, yes. So I said, so hopefully I'm gonna try to slate them in for the maybe the last Monday of the month or whatever.
That's fine. That's fine.
And then what's going to be beautiful? We're going to have the whole HU team in here. One day we'll have them on the same time so they could just
Okay.
share all
I
the
love it.
knowledge. You
I love
know, that's what. And then don't say anything, everybody. But we're going to try to get my cousin Fred on sometime because I like the way he bring it. You know what I'm saying too. Um, I have no problems making Real Talk strictly about health
it.
or Wednesdays we still going to do our thing, but I really want to put out the best content right now. Al is running for office, so he's been kind of MIA. Most of my time, like I said, has been with the restaurant. I've been doing that, but I'm trying to give you the best. I mean, we can turn up and party all the time, and but let's take care of ourselves. Real, we can have banter. Yeah, we could joke about me with the hot sauce, or the doctor could tease me about the plastic cup. I guess she gonna be the only person at the cookout this summer with a
Right.
glass. With a glass, the doctor. Listen, the doctor will have y'all messed up. Y'all not gonna be invited to the cookout because y'all gonna go to the cookout and say, "Listen,
And don't
can I,
and don't and don't heat your food up in the microwave on plastic food, please. Because y'all getting those nano particles in the microwave in your food. So coconut oil is good for everybody, from newborns on up. I tell people if you can eat it, it's good for your skin. So thank you. One of your listeners just said she uses it. She does oil pull. She cooks with
Mhm.
it. I do too, and it's good for your skin.
Okay, James, this is the last question.
That's another conversation. It's interesting with norovirus. A lot of norovirus we talk about food contaminants like on a cruise ship, etc. So an overview is called it's I call it contamination of food. So you got to also watch how the food handling, the storage, as well as people, with norovirus had. Let me just say, the big buffets, I'm afraid of those. I'm
Mm.
very much afraid of. So put a pin in that because that's a good question. And we already ran out of time. I got folks I got to get on some conversation with.
Okay, she got to go. Everybody's got to go. Diane, Doc, this is a
Yes,
good. This is a sister friend of mine too. Can she come? Can I give her your
yes,
information?
yes.
All
So
right,
pull out. Yes, yes.
all
All
right,
right,
everybody.
guys.
Say bye to the doc. I'm gonna talk to you for a few minutes about Row House and some other stuff. But listen, that's Dr. Marilyn Corder. For those that are supposed to reach out to her, text me as soon as we get off the show. I mean, thank you, Doc. I love you, cuz, for going over, the minutes. But we didn't even know. I didn't even look. Usually, I have chance to look down at the time, but from saying hi to everybody and stuff like that, I
It's okay.
yeah, the question was rocking. I mean, please pass it to tell your friends, share this information. Y'all could share a party flyer. I don't know if I've seen share anything with Row House yet. I'm gonna look on some of your pages. It's a little joke, but go ahead, Doc. I'm gonna chop it up with them for 5 minutes, and then I'm gonna get out of here for 2 minutes. So
Okay.
I'll talk to you
Now,
later. But I'm gonna
all
send
right.
them the information. All right, love you,
Okay.
love you, guys. I'll talk to you later. So yeah, listen. Let me know what you need. I love the energy tonight. I'm sure I must have been missed, and um, thank you, ladies. Uh, Stavon, thank you. It's good. I'm glad you just first time you saw it, but got to watch your boy. I'm on it. And Miss Berry, thank you. This was very good. I appreciate that. So please, I ask you all to share it, share the content. You can go to YouTube and share it, or you can just share the post that you just watched tonight to your Facebook page, so people can be more enlightened and understand what is going on. For people of color, we need that. You know what I'm saying? We you know, I know, cuz I know you got to bring moms up here one day. I just got to take that drive and come up here on a Sunday. She would love a Sunday. I know it would have to do something with church, but we just gonna have to get up here on a Sunday. Saturday might be too much for her. You know what I'm saying? It might be too much for her to handle. That's it. Hey, I see some people. What's up, Sharon? Thank you. I appreciate good content. Thank you. I appreciate it. So yeah, I'm still trying to bring the cop fella, the cop crew, as Stefania affectionately calls us. I'm trying to bring them back, when we get back here, because, right now things are going to get heated with politics. Look what's happening in New York. You got the National Guard standing with guns and stuff like that. But don't be on the main subway stations. Be in them subway stations that are desolate at night, where people are taking the train and nobody's there. You know what I'm saying? Everybody can be at the main station, 42nd Street, 34th Street. Let's be at the main one. I'm gonna try to come on Wednesday. I don't know if I can. I have like 2 meetings Wednesday that might interfere with the Real Talk time. But listen, like I said, I'm gonna try to give you the best content I can. I appreciate you all. Like I said, I rushed home today to make sure I can come on and give you something, because I miss it. I miss the doctor. I was so happy that Miss Scott, Dr. Scott, said she would join the show. So I'm trying to get her, her and her husband, or just her by herself. And I'm trying to get her for the last Monday of the month. And, shout out to the HU family, Howard University. They pumped out a lot of doctors and stuff like that. So she would be joining the show. So I appreciate you all. I'm now going to get me some hot sauce. Don't tell a doctor. Get some hot sauce. Have in my plastic cup. She don't want me to have my plastic cup. Watch. She's gonna be the only person at the cookout with a glass, and everybody gonna be in a plastic cup, and then they're gonna get kicked out because they're gonna say, I want to be with like the doctor. You're gonna be in a plastic cup. You've been in a plastic cup ever since I met you. You're gonna stay in a plastic cup. The doctor is a doctor. She'll drink out of glass. Families have its privileges. Everybody, Real Talk Chronicles. I'll see you later, man. Billy Council, I'll see you this Wednesday, my man. So, all right, everybody. I'll chop it up with you in a minute. Peace.